And I work with the Alaska Network on Domestic Violence and Sexual Assault. And on behalf of the Pathways Statewide Steering Committee, I would like to welcome each of you to our webinar series, Exploring the Roots of Violence and the Barriers to Health and Safety. I'm really excited today to welcome both Sandy Davidson and Diane Docis, who both work with Praxis International.
Praxis International. I do that now. I do that now. I do that now. I do that now.
Sorry, I'm going to go ahead and mute some folks because we're getting a really bad echo. All right, so like I said, Sandy and Diane both work with Praxis International, and they're going to talk to us today about the intersections of oppression as they relate to the ways that institutions organize and coordinate their workers. So Diane and Sandy, I'm going to turn it over to you to introduce yourselves and tell us a little bit about Praxis International and get us underway.
Thank you. Hi, everybody. This is Sandy. I'll start us off today. As Electra said, I'm Sandy. I am working out of our St. Paul office in Minnesota and work for Praxis International. I'm Anishinaabe from the White Earth Nation in Minnesota. I've been at Praxis for about 14, 15 years now. And I just have to say, maybe it's one of those kind of romanticized notions, but one of these days it's on my bucket list to visit Alaska. It's probably just everyday stuff for you, but to me, I see pictures and postcards, and I would really like to go there someday. So that's just a little bit about myself. And as we get started, before I have Diane introduce herself, I just want to explain that we're calling this presentation Different Paths, One Vision. And we're calling that because we all know that this whole issue of violence against women, domestic violence, sexual assault, trafficking, all the ways women are targeted for violence, it's a complex issue. And there's many different ways and many different paths that we take. But the important thing is that we have one vision. We want to make a better world. We want to make it a safer world. Along with that, we have all these different paths and different ways to address the issues within our own domestic violence and sexual assault programs. But we also have other agencies in our communities, that have a similar vision. They want to make the world a better place too. They want it safe for women and children. So it kind of ties in with this notion that there are many different paths, but we're all working together as community members to reach this purpose or fulfill this vision of ending violence against women. So Diane, you want to say a little bit about yourself?
Sure. Thanks, Sandy, and hello, everyone. So happy to be with you, and I hope I get to join Sandy on her trip to Alaska.
Yeah,
I said my only regret on this webinar is that it was not an in-person gathering. So hope to meet you all there sometime. And of course, you're all welcome to come to Minnesota, which I guess you'd refer to as down south, which is unusual for us to hear from, since we're used to being the ones up north, but you're norther. So I'm very pleased to be here and have this chance to talk with all of you. And as Sandy said, it's really focusing on what is that shared vision. And despite the fact that we're coming to this work and we have different roles, both Sandy and I are longtime advocates, so certainly that's the hat and the perspective we have. But one of the realities of doing this work is that we have to understand others' perspectives, other practitioners' perspectives, and what's directing their work. And that can help us see the things that can get in the way of that shared vision and what can help support it. So we're happy to get a chance to explore that and talk with you about that today. And certainly welcome your questions throughout all of this. So we know a PowerPoint sometimes directs the conversation, but we want to have some flexibility. So if there are questions that arise, we will definitely take the time to explore what it is that you want to explore. So I mentioned being along. Sure. Yeah.
I just want to remind folks to use the chat box if they have questions,
Yeah.
and we'll keep an eye on that, and because we've muted folks' phones. So.
Great, thank you.
Yeah.
And we will be asking you, actually, our first slide is a chat question, so we're hoping that you'll respond to those in chat throughout the webinar, so thank you for that reminder. I have worked at Praxis a fairly short time compared to Sandy, which is about 2.5 years, but was doing campus advocacy prior to that, and my roots in this work are in domestic violence work, and I've worked at different shelters as well as an advocate, as a prevention specialist, and coordinating a program. So, Sandy, you want to move us to the next slide, and we'll find out who is on the call with us?
Sure. Doesn't want to move.
It will eventually. Sandy and I, although we're both at Praxis, we are in different offices. So,
it's being stubborn.
So the little arrow on your, we told you we wanted this to be informal. So, just the arrow on your keyboard isn't working?
No. Is there an icon on top that I can use, Electra?
It should just be however you move your slides on your screen normally. It's nothing through.
Yeah, and part of our technology, we do a lot of online learning at Praxis and webinars, but we use a different format. So challenges, technological challenges when we're using a different webinar
Well,
format.
there it goes.
Yay!
Did you see it change?
Yes, we did.
Apologies, everybody. Now's your chance to chat it in. Go ahead, Diane.
Yeah, so we're interested, I know some of you chatted in and where you're from, so we have a little bit of info. We, I believe, don't have the poll feature, but you can just write in the chat area who you are. So are you doing prevention work primarily? Are you an advocate doing working with survivors of domestic violence or sexual assault? You know, we have possibly some public health workers or social service or child protection workers, law enforcement. Just interested in hearing from you what your role is. I see somebody saying public health employee, domestic violence advocate, sexual assault coordinator, state public health nurse, domestic violence advocate. Well, great. This is, and go ahead and keep chatting those in. And also, we're interested in hearing what role your organization has in holding perpetrators or batterers or offenders accountable for their action. You know, for some of you, you might be wearing more of a prevention hat, so it's a less direct accountability piece, but certainly connected. Oh, we have a campus advocate. Shout out to the campus advocates.
And I saw one batterer's intervention.
Oh, yep. Two, actually. I think they're
two.
I think there's two people and maybe on the same line there. So great. Yeah, so let's, Sandy, why don't you tell a little bit about the work we're doing here at Praxis?
Sure, but you know, I wanted to thank everybody for chatting in because it's really difficult, I think, sometimes over the, you know, over the phones and webinars and computers, and we don't always know who's on the other end. So it's really helpful to see who you are and get a little bit of a snapshot of who you are. So, like we were saying, we both Diane and I work at Praxis, and we're a technical assistance provider for the Office on Violence Against Women. We consider ourselves a social change organization, meaning that we want to, you know, change the conditions that cause and promote and support violence against women. We work with a number of different consultants from all across the country, and we work with advocacy organizations and many different types of practitioners. So that's some of the work that we do at Praxis, and it's all kind of, you see this visual here that it's kind of like everything is connected and we look at different organizations and how they respond to those that have been victimized by sexual or physical violence. And a big part of our work is to look at what those gaps are when a woman is brought into any system or walks into any one of our programs. You know, what are the gaps, the institutional responses? And a big part of our work is helping people understand how to bridge those gaps and have better responses to those that have been victimized. And I'm going to move to this next one.
Yeah, so both Sandy and I work specifically at Praxis for the Advocacy Learning Center, and I imagine some of you have been connected with that in different ways. And the Advocacy Learning Center is an 18-month course for advocates across the country, and including tribal communities and coalitions. And they participate in 3 different in-person events, and we focus on how it is that we're doing individual advocacy, how it is we're working to change systems or institutions that are in the lives of survivors, and how it is we're working to engage our communities and change the social norms that contribute to violence against women. You see up there the 3 sponsoring organizations of the Advocacy Learning Center. At this point, we've had hundreds of advocates from across the country go through the course, and including what we call extended placement, or we've had multiple teams from the same organization. And part of the focus is really looking at how we can structure our advocacy programs to do social change advocacy. And I know part of what you've been exploring in this webinar series is the role of oppression in our work, and that is deeply connected to social change advocacy and how it is that we in the Advocacy Learning Center approach this issue, and recognizing the ways that our advocacy has in many ways drifted from its original intent, which was to eliminate violence against women, and having those most affected by it, the survivors of battering, of trafficking, prostituted women, survivors of child sexual abuse, as central in the work, in the movement to end violence. And so our work is really focused on returning to that and how we can strengthen how it is our organizations are participating in social change advocacy. Anything you'd add to that, Sandy?
No, I was just chatting in someone was asking if this course was online, and I just chatted. If you want information about it, you can go to our website. It's a face-to-face or an 18-month course, and you sign up and apply as a team. But if people are interested, check it out and contact us afterwards. This presentation isn't necessarily about the ALC, but it's a big part of the work that we do, and it's a big part of the work we do in terms of addressing and oppression and integrating oppression analysis and all that we do. So yeah, that was a good summary there, Diane. I'm going to move on to this next slide here. Oh my goodness, what's the matter with it? It won't move now. I think I'm having technical difficulties.
I see your cursor moving, the little arrow on the screen, but I'm not sure what's happening with your keyboard.
Why does it do that?
I don't know.
Well, I'm going to talk about the next slide, and if it should happen to pop up by some strange quirk of fate, as we're talking about this and talking about our work for social change, we've really come to think about and talk about and expose people to a quote by Archbishop Desmond Tutu, where he talks about what justice demands. Because our work in terms of ending violence against women, changing social norms, addressing anti-oppression, working to change how our systems respond, so many different things are kind of all rooted in justice, right, and seeking justice. And Desmond Tutu says that justice demands three things. One, that the truth be told. And this is, this is a way of having women and survivors, male or female, give voice to their truth, to their experience, that the truth be told, that the different atrocities and oppressive actions that have been taken against huge groups of people. We want that truth to be told. And then he says that the second thing is that to whatever extent possible, that we work to repair the harm that's been caused. And, like when I started out, I talked about our own programs. We work so hard to repair the harm. We see, victims coming into our programs, and we hear the stories, and we know what's happening in the world, all the wars and injustices and what have you. And, I think it's kind of basic human nature to want to repair that harm. But it isn't enough just to repair individuals one at a time to create this long-term social change. Desmond Tutu also says, that it's so important that the conditions that produce the injustice be changed. And that's a big part of what we do at Praxis in our work and through our training. So I still can't seem to get this slide here to work, so I guess the presentation is over. No, I'm just kidding. I don't know what to do to make this move forward. So
I'll keep chatting here a little bit, Sandy, as you work on that, and I don't know if you want to. I can't come and assist because I'll lose my phone connection. So,
yeah, I'll try to figure something out here.
Okay.
Apologies, everybody.
Yeah, so as we talk about oppression, we just want to say a little bit. I know you've been talking about it within your within this webinar series, but we really define it as systematic and institutionalized mistreatment. So it's not, while it is enacted by people, including individuals, it is built and reinforced by social systems. And it's based on historical structures. So there's a whole history to oppression, but it's also current. So it's not just historical. I think we can see this when people might say that we've seen an end to sexism or racism, or that we're in a post-racial society. And the reality is that oppression, in many ways, we can see how it's enacted and continues to affect individuals and groups of people in the current day. Hey, look, slide moved, yay. And then the tools of oppression, I mean, there are all sorts of issues or topics that intersect with it, but what we would call the tools of oppression include prejudice and bigotry, discrimination, and stereotyping. And we won't delve into all of those, but I do want to reinforce that this is at the core. This provides the foundation of what it is that we're talking about, and particularly gender oppression and all the multiple oppressions that intersect with it when we talk about violence against women. And so in thinking about that, and I'll ask you to move the slide with my fingers crossed, Sandy, when we think about violence against women, we can examine it as oppression or as individual psychology, as kind of an individual problem. And when I mentioned the drift earlier in our advocacy that the Advocacy Learning Center explores, a lot of it is really based on this drift that has moved us, and perhaps quite deliberately, from seeing violence against women as a social problem, as connected, inextricably connected to oppression in all of its forms, or what has happened more recently as seeing it as an individual problem that is something then that we have to work to heal individuals in order to solve. And depending on our framework and how we're viewing violence, it really directs what we do to end it. So as I mentioned, if we're seeing it as an individual problem, we're going to do particular things. Then it's about serving survivors. It's about individual perpetrator accountability. And it's not to say that those things aren't absolutely necessary, but if that's all we're doing, the violence continues, that we have to have this broad big picture view of violence as a social problem. And you can see here in this slide some differences about how approaching it as individual psychology versus approaching it as part of and connected to oppression. Sandy?
Thank you, Diane. Yeah, and there's a few things that we want to kind of lay the groundwork for here. And first of all, what is social change? And our work, like I said, there's so many different things that have to happen. It's so complex, and the issues are so complex sometimes. But when we think about social change, it's really about what is it that changes attitudes, behaviors, the laws of the land, policies, and institutions, and how do we build these connections and expand our interactions with other agencies. I think communities across the country are working really hard to collaborate with other agencies in the community, battered women's programs, sexual assault programs, campus programs. We know that we can't do this work alone, but we also know that that we're organized to do our work in different ways. And it's important to understand, the way law enforcement is organized is not the same as how we're organized as advocates. Like we want to change how people think, act, and believe, but if you talk to a police officer, any police officer, a state trooper, law enforcement person, they're not going to say, well, this isn't my job to change attitudes and behaviors. It's my job to, to restore peace, or to, their role is way different. So just kind of understanding, like how other organizations are organized is really helpful. But our role as advocates, is really thinking about strategizing, analyzing, and trying to figure out what it's going to take to create change on so many different levels, that individual level, institutional level, community level. And it's about changing those attitudes, behaviors, and ways of thinking, both individually and within how systems are kind of thinking, what value they put or what they're focusing on. So it's kind of stepping back and looking at all those different things, and the thing about social change, I always think, is that it's really a painfully slow process. We want the change to happen. We want this better world. We want it safer for women and children, and we want it now. But we've kind of come to understand that there's some kind of methodical and really helpful ways to kind of look at how to create that long-term change, how to create change in laws, and while simultaneously working to change attitudes and behaviors. So, but I think one of the most important things that we stress, especially in the Advocacy Learning Center, is that it involves really some collective action of individuals that are, most impacted by a social problem, that come together and really think and strategize and move that agenda forward. So, I mean, that's kind of a long, convoluted way of talking about social change, but again, it is really complex, and there's many different ways to get there. And as we move forward, we're going to talk a little bit more about, like, as I'm looking at the different people that have signed into this webinar, there's people from different agencies and prevention. I'm not sure if there's anyone from social services or law enforcement or whatever. It seems like there's a lot of community-based programs, but the thing we want to kind of move into next and talk about is, we have this philosophical kind of understanding of violence against women being rooted in oppression, but we're going to move into some kind of concrete examples of how it is that we can look at how our own programs are organized and how other agencies or programs or institutions in our community are organized to help understand how we can better work together to better serve the needs or meet the needs of women and children that are victimized. You know, so each of these programs or agencies that you see on your screen here, they may have a different mission or purpose. Like I said about law enforcement, you know, it isn't their mission or purpose to, I forget what I even said, but it isn't their mission or purpose to change social norms, for example. You know, but though maybe a lot of the same folks that are coming into your advocacy program may have been caught up in the child welfare services or tribal law, social services or tribal law enforcement. I don't know what Alaska has in place, but you know, there's different institutional responses depending on the community and a lot of different things. But it may be the same people that you are accessing an advocacy program may also be involved in the criminal legal system or social services or whatever. So where there's differences in mission and purpose, I think the question is, are there differences in those using our services? And many times it's not.
So this is primarily a question, and this is Diane again, primarily a question for advocacy programs, although it would be interesting to hear from everyone. Does your mission statement address changing the social conditions that give rise to, support, and maintain violence against women? And you can just go ahead and answer in the chat, yes, no, or don't know. And if you have anything specific that you're aware of, I realize you don't all have your mission statements in front of you. And actually, even as I said, it applied primarily to the advocacy programs. I would be interested in everyone responding because, as Sandy said, it's being able to see that gap between, or the differences between our mission statements. So what it is that's at the core or what directs our work. And I'm seeing a lot of yeses, which I'm thinking are from the advocacy programs. And this really leads us into more of our thinking and what we want to talk about in the second half here around those differences and how understanding the different aspects, the different methods that direct our work, how having that understanding can help us in working with different practitioners or practitioners from different systems. But Sandy, why don't you start out by talking a little bit more about what directs the work of advocates?
Sure. Well, like I said, advocacy, and many of you are advocates, and you know that we've worn many hats, and we do many different things, you know, and again, it takes many different things to happen to achieve that vision of ending violence against women. Most of you do a significant amount of community organizing or doing public education or community education, maybe workshops or trainings on cultural sensitivity or anti-oppression work. If you're working with a coalition and other areas too, or even locally, there's policy and legislative work that influence and shapes social norms on so many different levels. We look at the history of violence against women that can go way back throughout time, and we look at the policies and the legislation that are put in place, you know, that keep and sustain violence against women, or you look at the policies or legislation that's put in place that maintains or sustains the oppression of an entire group. And if you look at the history of colonization and what's happened to tribal folks all across this country and how that took place, and it was reinforced by policies at the federal level that said, you know, we need to move these tribes out of the way, or the forced assimilation of children of Native children where they were removed from their homes and put into boarding schools, or, all these things are very intentional and deliberate. And when you look at some of the laws in place, to keep women in their place, those laws were intentional and deliberate too. So it's looking at all these different things and doing an analysis of what keeps that in place, and kind of going back to what Desmond Tutu was saying, how do we change those conditions that keep perpetuating this kind of violence or this kind of oppression against an entire group of people? The other things that advocates do a lot of is, building relationships and collaborating, like I said, with other agencies in the community. And again, kind of looking at who is at this, participating in this webinar. Looks like we have some people from public health, and, it tells me that your community, and I can't physically envision what that looks like, because I'm thinking Juneau and Sitka. I mean, you're kind of all over the state, but you're in collaboration together trying to make a difference in your state and in your communities. So a huge role of what the Advocacy does is build relationships and collaborate with other agencies. And they might start developing or participating on some multidisciplinary teams. But Diane's going to talk a little bit now about, when we're collaborating with these different agencies, or again, you're going to have a different mission or a different purpose, and she's going to explain and talk a little bit about how we can look in some helpful ways and make those collaborations stronger.
Thanks, Sandy. And this graphic that you see, which I think can be a little overwhelming on first glance, but with some understanding about what it represents, I think it can be a really helpful tool. I found it to be a very helpful kind of framework to look at how it is that I, as an advocate, am interacting with, or when I was part of an advocacy program, how that program was interacting with other institutions in the community. And recognizing that in any work setting, for any worker, that we don't just come to work, even if we have a lot of flexibility, we don't just come to work and do whatever it is that we want. I mean, we don't, as advocates or TA providers, police officers don't, public health nurses don't, that there are a number of things, and I have identified, or the work of Ellen Pence and Dorothy Smith, working to identify the 8 methods that institutions use to standardize or coordinate workers, to say, we can't just have everyone doing whatever they want. So we have laws that police officers follow. We have rules and regulations that any of us, that affect the work of nearly any of us. So whether that's HIPAA, if you're in a health setting, whether that's the Constitution, if you are an attorney or in law enforcement. So there are all of these different things that direct our work. And when we understand how different practitioners function, because remember, as Sandy said, that when we're working in these communities with all these different institutions or in CCRs or SARTs, that understanding that we are all directed by many different things, but in different ways, can help us do 2 things. It can help us understand that when a practitioner responds in a way that we might not like or we find problematic, that it's not about that individual practitioner, that there are all these different ways that their work is directed. And it can also help us see where we can create change. So when we're frustrated by an institutional response, we can step back and say, what is it that is creating that response? So, I think about working on a campus and that being, having there be some horrible response to a sexual assault survivor who is, going to end up having to leave school because the perpetrator was still in her classes. And so then it was stepping back and saying, what does our policy say? And what might we be able to change in that policy to then end up in a different response that will be a more helpful one for that survivor. And so just to touch on a couple others, and we're going to dig a little more deeply into a few of these, but you know, concepts and theories, I think, can be a hard one to wrap our heads around, but it's really just how we talk about a problem. And we know as advocates we talk in a particular way when we're talking about sexual assault or domestic violence, but the language of law enforcement is very different around those same topics. And that affects how we think about and act on those issues. We mentioned earlier and did that quick little poll about our mission. So depending on what's in our mission, that directs what it is we do or don't do about a problem. And in particular, as we explore in the Advocacy Learning Center, how can we make sure that institutional change and social change are also in our mission statements? Because then we're able to say, you know what, that's part of what we do as advocates. That's part of what our program is supposed to be doing. That's our role in our community. It's in our mission statement. But let's dig into a little bit more detail on a few of these. And I also want to say, you know, as we continue in this, to feel free to chat in questions as they arise. So Sandy, can you move us to the next slide? Yeah, so one of the 8 methods, or the 8 ways that institutions direct how we as workers or practitioners do our work, is administrative practices. And this is really what tells us how we carry out whatever laws or policies direct our work. And you know, we all have paperwork of different sorts. So whether it's an advocate and you have an initial contact form when meeting with a survivor, whether we have a screening form in our work, or I think about in healthcare settings, the history form that initially patients fill out, but then the practitioner reviews. We have job descriptions that tell us what we do as part of our work, and all sorts of guidelines that direct what it is that we do. And it's not always paperwork, of course. It can be a computer screen for law enforcement, or computer intakes that some of us do now as well. But again, when we think about how we can create change, one of the ways is to reflect on how these practices, how these forms, how this paperwork directs what it is that we're doing with survivors. And Sandy, that was a very broad overview, but is there anything you would add to that?
Well, I was just thinking, I just want to encourage people to think, when you're collaborating with other agencies in your community, it's important to talk with them to see what kind of administrative practices they have, because it helps you understand how they're organized to do their work. You know, they may have that same vision of making the world a better place, but they have different practices in place on how to get there. And what happens so many times, I've seen it, doing this work for so long, is we start saying, oh, those darn police officers, or those darn child protection workers, or, even prevention workers, their mission and purpose it is different than the role of most advocacy programs. But it's really important to talk with each other and understand, what is the job description of a particular worker from an agency that you're not familiar with, but you're working with and you're trying to collaborate with. What guidelines do they have to adhere to? Now, I don't know what the social welfare system is like in Alaska, but a lot of my work has been around child protection issues and child protection responses. And when I first started doing this work, it was just like, oh my gosh, they're all terrible. They just want to take our children, and they just want to hurt everybody, But then as I gained more skills and I understood more about what Diane has been talking about here on how workers are organized, I realized that it isn't the individual workers, it isn't that nasty old child protection worker from that county or that terrible police officer from over there. It's how they're organized to do their work. So a huge role of advocacy is, how is it that we step in and understand and come to understand, what the job descriptions are, what laws or statutes do they have to follow? Are there guidelines that dictate how they work? What paperwork do they have to complete? So I just encourage advocates all the time to, when you're working and collaborating with other agencies, find a way to really kind of explore that, because you'll understand their work better. Let them know what you do. Explain your mission, purpose, and function. Talk to them about some of your job descriptions and what the advocates are trained to do. And then you can kind of come together and say, okay, you do this and we do that, and now we know that this agency over here does that, so how can we work together? Because we have this common vision. We want to make life better for women and children. We want to do things different, and that's all part of prevention, right? It's how do we work together to make sure that this doesn't happen to one more child, to one more woman, to one more person, human being on any level. So, I guess that's what I would have to say about this administrative practice, and just kind of encouraging advocates to to step back, and even other agencies, if you're not an advocate, to step back and look at how you're organized to do their work, because it's amazing the things that you'll learn. And then you can work together to, okay, well, now we know what we're dealing with. How can we figure this out and really keep that focus of, woman-centered and survivor-centered, keep that at the focus of, we have different job descriptions or different tasks, but our main purpose is to make a better world and to for women and kids. So
exactly. Thanks, Sandy. The other thing I think of here is how many of these things that we inherit in our programs and that institutions, they just exist because they've always existed. So it can be a really eye-opening experience to take the time, not in our own programs as well, but also in connecting with other institutions and practitioners to realize we have the power. Sometimes it takes some doing, depending on the institution, but to change these things. Administrative practices are often easier, in theory, to change than something like laws and regulations. Those are changeable too, and certainly coalitions have a big role and have done amazing change in laws, but that administrative practices, sometimes it can be a simple change. Sometimes it's more complex, but to realize we can create change in these. So you want to move to the next slide, Sandy?
Yeah, but I just want to make one more comment here. As
Sure.
I'm looking at this, I'm realizing, because you were saying sometimes we inherit certain things. We start a new position or whatever, and whatever has been going on for the past 10, 15 years, we just step into and continue doing it. So I always encourage advocates to kind of step back and think, okay, why are we doing this? Like I'm looking at the top of the screen here and seeing screening and intake forms. Now I remember when I first started, and they had intake forms and they had different tools to use. And then as I learned more about advocacy and what it means to think critically about everything that we do, because it impacts the lives of battered women and children and sexual assault survivors, male and female. But where does the term intake come from? It comes from kind of a medical model, which grassroots advocacy programs weren't really looking at being a medical model, and they were saying pretty much the exact opposite. It's not their role. It's not that there's anything wrong with a medical model or a psychological model. It's different. But, think critically and take a look at, are you using terminology and forms that come from another field? And then what can you do to make that fit your mission, purpose, and function? I just wanted to add that, Diane.
Sure. So I'm going to touch on resources here. Sometimes we get stuck in thinking and talking about resources because the reality is we always need more, right? We need more money, we need more people, we need more time. But I think one of the ways we can look at resources is just to step back and say, how are they allocated? So we know typically institution will have a certain budget, or even our advocacy programs, to think about how are those resources being allocated, whether it's staffing, whether it's time, whether it's money, and where might things be able to be shifted to close the gaps, so we referred to before, between what it is that survivors need and what it is that institutions are doing. Because even if it's true that we always need more, we always are faced each day with having to do whatever we can with what we have. So how can we shift things around while at the same time working toward increasing our resources? Can you do the, there we go. So we want to spend a little bit more time here on thinking about linkages, because this is such an important piece, and especially as we're talking to this group who are linked in so many different ways across institutions. And when we talk about linkages and how that directs our work or affects our work, we can, I think a way to look at it is to look at who comes before us and who comes after us when we interact with a survivor or get involved in a case. And we can see a lot of different linkages we have. So whether that's, if I'm a sexual assault advocate and I am linked with SANE nurses, I am linked with law enforcement, I am linked with criminal and civil attorneys, I'm linked with court personnel, I'm linked with community members and particular communities. So there's all different ways that linkages affect us and affect our work. And we can also think about who we aren't linked to that maybe we should be. That just as we inherit forms, often we inherit or we just keep doing as we've always been doing and stay linked to the same people. But what are some ways we can stretch those boundaries? And I think, you know, that's happened in so many ways in our movement. And even to think of having public health nurses on this webinar, I mean, that's been a fairly new linkage in this work, to realize all these different connections that we can make. And then thinking about that too really takes us back to the theme of this call or this webinar, and thinking about our shared vision. So even though we are these different institutions or different parts of a system, and we have different ways of doing the work, how might these linkages reinforce that shared vision we have of ending violence? And one of the ways we can think about all of these methods and learn more about how they direct the work of a practitioner is to have conversations, or even a more, you know, kind of formal/informal interview to ask questions. And I think that's a way that we can learn, you know, Sandy was saying, when we get frustrated with a practitioner and why they're acting as they are, or you might have a conversation and hear, you know, a child protective worker or a police investigator say, you know, I'd like to be able to do this, but my hands are tied. But when we talk to them, we can find out, well, tell me more about that. What is it that is tying your hands? What is it that directs your work? What are the laws that mean you can't take this action that I would like you to be able to take? And as we learn that, again, thinking back to those 8 methods, we can see where it is we might be able to create change. What would you add to this, Sandy?
Well, I was just thinking, I'm looking at that middle circle and thinking, who aren't we linked to? And, you know, like I'm thinking, again, I'm just trying to envision Alaska, because you know what goes on in Alaska is going to be totally different than Minnesota. But, you know, we've had enough advocates and programs come through the Advocacy Learning Center and through a lot of our other programs at Praxis, our rural program and stuff, that we know that you know, there's a lot happening in the villages up there. So are you and your programs and your community agencies linked to the village police officers? I think that's what they're called, or you know, to other community members in the different surrounding villages. And how are you linked? And and what would be, how could you strengthen building partnerships and building relationships with outlying villages or other smaller communities even. You know, it's, you know, our work to end this, you know, we started out talking about the intersections of racism, classism, sexism, all the different forms of oppression, you know, and we have to be cognizant of all aspects of our communities and to try to be as inclusive as we possibly can. So I would encourage all of you that are on the call here to think about who aren't you linked with and how can you strengthen those connections, you know. Oh, there's something else now I kind of forgot, but that's what I was thinking of for right now, Diane.
Well, thanks, Sandy, and I see that we're coming to the end of our time, so I'm just, you know, turn it over to you to wrap things up.
Yeah, I wanted to go back to this one chat here. I have 2 village public safety officers linked to our SART team and also their supervisor, and we've been providing information out to the villages also. Yeah, that's really good. And I wanted to say just a bit more because you're mentioning SARTs, because we were going to talk about the, you know, how important it is to facilitate those interagency teams, you know, and to strengthen interagency responses and, you know, to reach out to the VPSOs and bring them into the sexual assault response teams or the other multidisciplinary teams. I mean, that's what you have to do. And one of the things that I see with programs all over the country and people that are trying to form multidisciplinary teams, they really, really struggle. They want to bring people together and talk about it, but they don't really know what to say and what to do and what to do next. So to build those connections, they might plan like a brown bag lunch or whatever, you know, but, you know, these teams are so much more than just getting together and, you know, socializing. You come together because you want to change the policies and practices. You know, a sexual assault response team, you know, how are the law enforcement responding? How are they doing the investigation? How are they documenting that? You know, and what is their practice? So when you pull a team together, what that your team's purpose to come together like that is to look at what practices are causing more harm to a sexual assault survivor or to a battered woman, you know, or if you're on a child protection team, you know, what policies and practices are causing more harm. We know there's problematic responses all over the country when children of battered women are being removed from a non-offending mother. You know, we've learned from history that the forced removal of Native children from their families and community has been devastating. And I always ask, how come we're not learning from that history? It's devastating for a child to be removed from a mother who is not harming them. You know, but that system is organized in a way that they're not looking, you know, they're not looking at it the same way. They're not taking up battering or even sexual assault in the same way we are as advocates. You know, so how can we work on a team and work together to understand what the roles are, like all those things that Diane was talking about, what guides how they do their work. And if we see something where there's a gap, how can we work together to change that and make it better so no child ever again will have to be removed from someone who isn't even hurting them. Or you look at all the other, you know, we have these different kinds of teams. I don't know what you have in Alaska, but it can be challenging sometimes because we get really defensive about our work, about our training, our education, our whatever, you know. But, you know, these 8 methods that Diane went over, and there's no way we can cover this, you know, effectively in an hour webinar, but, you know, we'd really encourage you to learn more about and then to think about it, you know, to think about how other agencies are organized and what they do. You know, what's the role of the VPOs up there, you know, compared to like other law enforcement or state troopers or however it's organized in Alaska. It's going to be different, you know, it's going to be different in different parts of a bigger city. And, you know, to talk about all those things and think about how to have the best possible response, but you work together to do that, you know, and I think one of the big things I want to kind of leave you with is I've been one of those advocates that I get so angry and frustrated, and I'm saying, why do you keep doing this, you know? And it doesn't get me anywhere, you know, or I get angry and frustrated, and, you know, I had to think, who does it benefit when I'm angry and frustrated? But I don't have to be as angry and frustrated anymore when I understand what these, you know, how each organization is organized, and that I can go in there, you know, and, you know, talk to them and find out what do you do and how do you do it and what guides you, and let's look together and see what these gaps are and see if we can figure out and how to make this a better place. So I'm kind of trying to scroll through the chats here to see if I missed anything, but does anybody else have any questions or thoughts that you want to chat in before we wrap it up? Because we're happy to respond to any questions, or even after the call is done, you know, you're welcome to contact us.
Sandy, I've had a couple of folks ask if you can make the slides available. So if you want to send those to me, I can send them out with both yours and Diane's contact information to folks.
Sure. Okay. Yes, we sure can.
Okay.
But, you know, I think we may even be going overtime, but I just want to thank everybody for joining the call today. And, oh, I just wish we had more time now, because I'm looking at this one. Their oversight troopers are different for 2 of our 4 villages. But anyway, I'm hoping that we sparked some, you know, got you thinking about a few things, and continue with the conversation. And thank you for your good work, and thank you for inviting us to be on this call.
And thank you to both you and Diane for joining us. It was a pleasure to have you all on the call today. All right. Well, thank you, everyone. And again, this webinar was recorded, so we'll have it posted on our website, and I'll send out a link as well.